work within the NHS, but also at the University of Leeds. So my work is a mixture of clinical work and research. In terms of how we look at different types of breast cancer, there's a key way in which we differentiate or we subdivide the different types of breast cancer. And that's based largely on how the cancer looks under the microscope. So it's the pathologist who's looking at a biopsy, a sample of tissue in the laboratory that tells us about the cancer and what subtype of breast cancer it is. And the key way that we make those subdivisions is by looking for what we call receptors on the surface or on cancer cells, on breast cancer cells. And those receptors are a bit like the satellite dishes that you might see on the front of a house. And what they do on cells is that they receive the signals of chemicals that are circulating in the blood. And for breast cancer, what we're looking for are hormone receptors, the estrogen receptor and the progesterone receptor, and a third receptor called the HER2 receptor. So when we're told that somebody has breast cancer, as an oncologist, one of the things I want to know is what type of breast cancer, and that can be either hormone receptor positive, HER2 positive, or if the cancer doesn't have any of those receptors, doesn't have estrogen receptor, doesn't have progesterone receptor, and doesn't have the HER2 receptor, we call that triple negative breast cancer. TNBC is different because it doesn't have the hormone receptors, it doesn't have the HER2 receptor. And what that means is that a range of drugs that we use to treat breast cancer aren't available. They simply wouldn't work in people who have got triple negative breast cancer. So people who've got hormone receptor positive breast cancer, we use hormonal drugs. For people who have got HER2 positive breast cancer, we have drugs targeting the HER2 receptor. But because TNBC doesn't have those receptors, those types of drugs wouldn't work, so the drug treatment for people with triple negative breast cancer is quite different from the drug treatment for those who've got hormone receptor positive or HER2 positive breast cancer.